Greeting once again. It's a pleasure to be back again. This is the other session that we're starting today. And as I mentioned in the last episode that we had on talking about self-care, today we're going to talk about pharmacists in primary healthcare. So when we talk about primary healthcare, what are the key aspects that I'm going to look at in terms of the role of a pharmacist and what are pharmacists doing in these spaces and what would be the envisioned future? So it will be based on the flow as already outlined in the slide ahead of me that you're looking at. And when we talk about what constitutes primary healthcare, I would be critical to look at it from the essentials elements of primary healthcare, where we talk about the education aspect, prevailing health problems, and people getting informed. And in the last session that we talked about self-care, we realized that for people to practice self-care as much as possible, they need to be health literate. And therefore, that literacy is driven by education and information that is shared. So how do we have contributing aspects in terms of health communication, health education, and the literacy aspect? Then we look at the locally endemic diseases. So who is going to drive the prevention and control of these endemic diseases? Who is going to contribute to that aspect? And actually identifying them before doing interventions to deliver them. We need to know what's endemic and how do we address them. Then now we institute the preventive measures, control measures, the management protocols that are going to ensure that is happening, and providing access to the medication. The other bit we look about in terms of expanded program on immunization, because we understand vaccines play a critical role in our health outcomes. And therefore, how do we ensure that vaccines are working for people? How do we drive vaccination programs and immunization programs, including in terms of our disease outbreaks like the one we've had? Maternal and child health, a critical component in terms of access to healthcare services, and that even covers for reproductive maternal contraceptive services and related even fertility concerns. Then we look at the essential drugs management and arrangement. So who is going to ensure the essential medicines are available? And the essential medicines will be those that are meeting the healthcare needs of the population. So what are the needs of that population? And that is those are some of the things that we need to look at when we're talking about primary healthcare. Nutrition, we know nutrition challenges are a problem, and how do we address these? Because at the end of the day, people have to be healthy, and health is not only within the healthcare space, but the other domains and sectors that play a critical role in that. So nutritional aspects in a critical bit as well. Then treatment of communicable and non-communicable diseases, including promotion of mental health and mental well-being, which is a critical topic that I'm very passionate about. We'll talk about it in a subsequent session as well. Then we look at safe water and sanitation, because we know most of the infectious diseases are contributed to by poor hygiene, poor sanitation measures. And therefore we need to look at how do we then entail these elements of primary healthcare and ensure they are a critical piece of everything that we do to deliver quality healthcare services and promote well-being in our communities and to the patients and populations that we interact with and support. So when we look at that, at the constitution of primary healthcare, then we need to ask ourselves, what are the needs of communities when you talk about primary healthcare? And the needs of communities when you talk about primary healthcare or even healthcare in general are around the key continuum of care components. And that is one, infection prevention and control, which is a critical bit. We need the health promotion and the disease prevention component as the critical first pillar. And that would entail ensuring there's access to food, access to quality, good water, sanitation, and hygiene. So that, first of all, we want to try as possible to ensure nobody is falling ill. Everybody is healthy as much as they would wish to be, and we enable them to stay healthy. Then other than that infection prevention and control aspect, we look at the next phase. Some will fall ill, they'll be unwell. So how do we care for them? That is the treatment, the curative aspect of care, so that they have access to curative measures that are going to treat their conditions. For those that are non-communicable and the chronic condition that is, then we have to ensure there's a long-term management plan, and that means there's access to medication, access to care, access to supportive management for these patients. So we look at the curative and the management therapeutic options for patients. Then other than the therapeutic options, the next phase would be people who are now having other conditions would say that they'll need rehabilitative support and rehabilitative care. Let's say somebody who had a fracture or somebody who has been using drugs, substances of abuse, and therefore needs supportive care to get rehabilitated back to their normal functioning in a good health state. So there are rehabilitative components. Those are another areas of work. Then finally, we have the palliative care. Somebody who is, let's say, for example, cancer patients at end-stage disease. These patients might not be able to recover, but the pain that they are undergoing need to be supported. They need intervention that are going to enable them to stay, at least live meaningful, dignified lives. That is the pain management component. So what palliative services are we going to make available to our patients? And then finally, understanding all these continuums of care, what are the other needs? The other needs would be using these available information in the care areas in terms of health to inform policies that will ensure patients have the best quality of care. The resourcing is available to ensure these services are being offered. The people who are offering the services, that is the healthcare workers, are empowered and enabled to deliver on those healthcare mandates. So once we understand the needs of communities in that perspective, then we could target into one of the elements of primary healthcare, as I mentioned, in terms of the locally endemic diseases. What are the needs in terms of what are the disease patterns? Because once we identify the disease patterns, the epidemiological patterns of any particular region, then it means at any one level where I am practicing as a healthcare professional, I'd be able to address the needs of that community. I'd be able to intervene by giving solutions to those healthcare needs. For example, if I work in a community where neglected tropical diseases are a burden, for example, leishmaniasis, then I would be able to institute diagnostic measures, infection prevention and control, including environmental control, to ensure that we reduce the burden of these leishmaniasis, for example, cleaning bushes, sandflies, ensuring the vectors are reduced. Then with that, we are also helping reduce the infection. So for those who are unwell, we need to have diagnostic measures to ensure they're diagnosed early. The management is in place. Do we have supply of medicines that are needed for the management of such conditions? Then once we manage them, how do we ensure that is informing policies in terms of even supply forecasting to ensure on an annual basis we receive, let's say, 10,000 cases. How do we treat them? What is the dosing regimen? Do we have a forecast that can ensure at any one point we never miss medicine that are needed by patients? So we need to know the needs based on the disease pattern, the epidemiological pattern, and then we look at it from the continuum of care, from health prevention, health promotion, disease prevention, curative, rehabilitative, and palliative support. Then ultimately, the health system strengthening at a policy level. So once we see that aspect, then the key other bit would be, what is the pharmacist's place in primary healthcare? Where do we practice? And how is this linked to PHC? Primary healthcare, that is. So when we talk about it in the community level, pharmacists would be practicing at their community pharmacy outlets. That is a critical component. And when we see primary healthcare at the first level of contact of an individual, a member of the society to the healthcare system, then we acknowledge that at community pharmacies, that is almost always where people will seek healthcare services at the first point of contact. And that is because we believe pharmacies are going to give us the medication that we need, they're going to give us the support that we need to achieve positive health outcomes, and therefore most members of the public will go to them. And because also for the convenience and the reliability and accessibility. So if those are the drivers, then how do we take advantage of that and ensure they deliver on their needs in communities and ensuring that they contribute to driving the primary healthcare? Other areas where pharmacists would practice would be based on non-governmental organization, non-profit organization, or the mission-based, faith-based organizations. Because I know these are also play a critical role, especially in delivery of healthcare services in communities, in especially rural and the remote areas that there are different countries. So how do we engage with them? And there would be like, they're running programs that are supporting particular disease needs areas. They're running these programs, managing them, ensuring access to medicines. And if they're in the clinical settings, they're actually even coordinating the dispensing of medicine, health education, and related. So those are other areas. Then ultimately we'll move at it to the government institutions, government hospitals, where they may be running the pharmacy outlets, medication therapy committee, MTCs. What's their contribution to that? How do we ensure that the other elements of primary healthcare driven strategically and contributing to the realization of the aspirations of everyone in that space? Then finally, at the leadership level, we have policymakers or pharmacists. How do they integrate the clinical component and the basic background of the science into informing policies so that we have evidence-based and responsive policies that are going to address the healthcare needs? So the places where we work will influence how we practice and what our interventions that the key outputs are. And in that case, that I think the best approach for us also, you need to reflect on a video that I shared earlier on the project-based management and the role of pharmacy, future pharmacy being project-driven, because in any area that we work in, there are key deliverables, the key performance indicators that guide how we work, what are the outcomes of our work, and how do we measure those outcomes. So if we can look at it from that dimension, then we are able even to look at the needs of the communities and our practice setting to ask ourselves, what can we deliver? Can we contribute to health promotion and disease prevention? Can we contribute to treatment, immunization programs? And over COVID-19 vaccination has been a critical bit, but what are we doing in that space? Are we driving that agenda? Are we being an integral player? and what are the remuneration packages around such kind of services, because at the end of the day, the incentive factor in terms of what is in it to ensure that as pharmacists, while we deliver these services, we can sustain it, because there are resources that are needed to ensure that is happening. So the service level agreement that we can have with the government or other stakeholders who are financing such solutions need to be in place. So when we look at all that and where we practice and how it's linked to PHC, then what are the current experiences? The current experiences, we have the different areas of work where we operate. And it's good that pharmacists are doing this, but unfortunately, most of it is never documented. And lack of documentation means there's no evidence to prove what we do and how it's being done. And there's no room for sharing of best practices unless we document such kind of work. So that is a gap that we have in the current experiences. And two, when we look at it in terms of the disease prevention, health promotion, we do it, yes, even in community pharmacy, but not as much, because most of the time we wait for patients to get to us when they are unwell to buy medication. And the process of buying medication, that is where we give additional information. In an alternative sense, what if community pharmacies could deliver by having programs that are run in the communities where they work? And who could be able to support such programs? One of the things that I'm very critical about is the aspect that the other interested stakeholders and partners who could be key allies in helping us deliver on these. For example, when we talk about antimicrobial stewardship, we have industry organization, pharmaceutical companies, biopharmaceutical industry, who is keen on ensuring we reduce the burden of antimicrobial resistance and ensure that we practice antimicrobial stewardship principles to ensure we are able to ensure that in the next phase of life, nobody will suffer from these infectious diseases, because we will suffer from them and fail to get the treatment they need because of antimicrobial resistance. So can we collaborate with them? Can we work with them to deliver interventions in communities that would ensure we have sustainable business models, but at the same time, these sustainable business models are serving the communities and meeting the primary healthcare needs that we have. So those are some of the areas that we need to look at. That is not happening as at yet, because we don't have those structured partnerships and collaborations. Other than that, when we look at the mission hospital, they do the planning, the delivery of solutions, yes, but how sustainable are some of them? For example, when I talk about medical outreach, they would be done once a year. Once a year is not sustainable, because at the end of the day, you're doing it this year, next year you'll have to wait. Then over the period in between, do we say that people are not having healthcare needs? And if they do, how do they ensure that it's done? And I remember there's an article that I wrote a while back when we were looking at community-based clinical pharmacy practice. And one of the things that I was talking about is we could have medical outreach in communities. Then with this medical outreach that are done, we have kind of a signposting referral mechanism that is integrated in the local facilities. And once we do that, we are able to deliver quality healthcare. So those are some of the things that are there. So what is the envisioned future of PHC with pharmacists at the center of it? Well, the envisioned future of primary healthcare for pharmacists is where pharmacists are actually playing their entire role in terms of the scope of what is expected in primary healthcare, from disease prevention, health promotion, curative, rehabilitative, palliative. And in that case, then the project-based, program-driven interventions would be key. And therefore, we need to partner with allies. We need to drive public-private partnerships where feasible, private partnerships, B2C businesses, and to the communities. Do we partner with communities from administrative units to every other stakeholder that is available in the communities? Then once we design the interventions, then we are able to support in achieving the primary healthcare needs. Other than that, we need to document, and documentation is one of the videos that I talked about a while back. Can we document our work to show the evidence? Then using that evidence, we develop toolkits and advocacy materials that can help us shape the conversation. And as we shape the conversation, we interface with governments and stakeholders that are going to develop guidelines, laws, policies that are shaping how we work, and actually creating a new conversation, a new way of doing things. And those new ways of doing things are what's going to shape the future of the practice that we're hopeful for. So in bridging these, we have to be deliberate and intentional about it. We need to work by knowing what our communities need and delivering on it. I remember at one point I talked about whether some young pharmacists should pursue their primary healthcare internships in Kenya. And when I was talking about that, I looked at what I was doing and what I was part of during my primary healthcare internship. And I realized that there's a lot that's happening. And when all this is happening, unless we're part of the conversation and unless we plug into the existing systems, we might not do much. And by doing much, I mean, when we're not part of the system, we don't know what needs are there, and therefore we can't intervene. But by being part of the system, we know what needs are there, We deliver interventions, we think about the solution by being part of the problem and knowing how we can deliver on it. Because that knowledge, that awareness is what is key in helping us ideate. And by ideating, we're now able to solve problems. So I think that's a critical bit. We need to be part of the primary healthcare teams. We collaborate with other healthcare workers, from community healthcare volunteers to physicians, family health doctors, to the clinicians that are there, nurses, midwives, and all the traditional health workers that we might be having in our communities. Then other than that, we interface with communities and the administrative unit, the government institutions, so that we understand what are the needs, how do we deliver, and what does that success look like in such kind of a component. And once we're able to deliver on that, we'll be on our trajectory to making wins as a community and as pharmacists in primary healthcare practice. And on this, actually on 15th, that will be on Tuesday, I'll be talking about modeling integration of pharmacists in primary healthcare towards the realization of sustainable development goal number 3. And I'm inviting you to be part of the discussion. Check my LinkedIn account, the Africa Pharmaceutical Network, or even Reculture page. The link is there for you to register and be part of the conversation, because we need to model how do we integrate. And I'll be sharing some of the ways that we can integrate and actually deliver on those solutions. I've highlighted some of them in this video, and I'm hopeful we are going to make advances together. If you enjoyed these sessions, please subscribe to the channel. Let's engage, let's learn together, and promote it among your colleagues as well. Thank you.